The fingers and hands are two of the areas most commonly affected by arthritis, whether you're talking osteoarthritis or the inflammatory varieties. Now, symptoms of these problems commonly include pain, stiffness, swelling, and loss of function. And if you suffer with any of those problems, you're gonna love this week's video because I'm about to show you a simple 3-part strategy that you can use to eliminate pain and regain functionality in your fingers and hands. Let's get into this. Step 1 in this approach is to mobilize and release the hands. See, one of the most common manifestations with problems like these is you get a clawing of the hands where they kind of pull inward to the middle point of the hand. So the fingers kind of collapse in like this and the palm closes in on itself like that. And oftentimes people will lose the ability to completely flatten out their hand like this and to fully extend the fingers. And so step number 1 is to regain the ability to do both of those things. And I like to start off with a simple myofascial release, targeting the big thick muscles here at the base of the thumb in an area called the thenar eminence. The only thing that you're gonna need to get these dense muscles here at the base of your thumb to relax and let go is a ball. Now, a tennis ball works fine, but my favorite tool for this is the neuro ball. This spiky surface gives a fantastic release. From there, you're gonna place your ball either on the floor, or what works really well for this is to have the ball on a very sturdy table so that you can get over it. You wanna have your arm completely straight so that you can just lean your body weight on it. You don't wanna be crunched up so that you're having to use muscular force. Keep the arm straight, and then you control how much pressure you get just by how hard you lean on that ball. If it's very sensitive, keep most of the weight centered over your body and you get a very light pressure. If you really want to get into it, just lean on the ball. And then you're just going to roll back and forth, and you can kind of go in like a fan-shaped direction and go in a few different directions when you're starting out and see where the most tender tissue is or where you find the most thickness, and then you can focus there. Now, the direction that you're going to be going is primarily horizontally here, but the fibers kind of run almost like a fan that branches out with a wide area here and the narrow area here at the thumb. So that's the direction you're going to be rolling. Focus on the most restricted or tender area, and 30 seconds is plenty to accomplish what we're after. Once you finish that, switch over to the opposite side, do the exact same thing. The second component of this mobility routine involves bringing each finger individually into extension. So for this, I press my arm straight out in front of me. Notice my wrist is bent backwards and my elbow straight. From here, I'm going to lightly grasp my index finger and gently pull that finger toward me. The key word here is gentle. So it's 5 seconds of pulling, and you're going to feel a nice stretch through the finger, the palm, and into the underside of the wrist and forearm. After 5 seconds, you'll move on to your middle finger and pull that back toward you. Then ring finger and pinky finger. Notice my elbow stays straight throughout. Now, when you get to the thumb, it's a different story because you need 2 directions of pull to release the thumb. The first is with the arm straight out in front of you. You're going to grasp the top of the thumb and push downward, moving it away from your index finger. You're going to create a nice 5-second stretch across the webbing of the hand here. And then the next, you need to grab the base of the thumb here and create opposing pressure with your opposite hand as you push away with, in this case, my right hand. And I'm moving that entire mass of thumb starting way down here at the base away from the center point of the hand, getting a nice 5-second stretch through the thumb joint and through all these thick muscles here in the thenar pad. And once you finish 5 seconds in each of those positions, you move on to the opposite side and repeat. The final part of this mobility routine is a gentle rotational mobilization of each of the fingers. So for this, I keep my hand pretty close to my body, take an overhand grip, grabbing one finger at a time. In this case, I'm going to start with my index finger, and I'm going to gently roll that finger while I take a light grip on it toward my middle finger. After 4 or 5 rotations, I'll roll in the opposite direction, in this case, rolling away from my middle finger. I'll then grab the middle finger, roll towards the ring finger, and then roll the opposite direction towards the index finger. And moving through each of my fingers like that, rolling away and rolling toward. Pinky, rolling away and rolling towards. And finally the thumb, rolling away and rolling towards. Now in this case, I help out with these motions by turning the hand that I'm mobilizing in the opposite direction that I'm going with this hand. But I grab, twist, and release, re-grab, twist, and release, just like that. And then in the opposite direction, just like that. Grab, twist, release, grab, twist, release. Each of the fingers, both directions, repeat on the opposite side. One important thing to keep in mind with the rotational mobilizations is that the joints don't move very far in this direction. You're talking fractions of a millimeter. And so it's important that you don't force anything when you're doing this. The purpose of this is just to get a little bit of motion into those joints, and it should feel good the entire time you're doing it. Part 2 of this strategy involves taking specific nutrients that have been shown to reduce pain, improve functionality, to slow down and maybe even stop the progression of joint degeneration in the body. The first substance that I want to call your attention to is chondroitin sulfate. And there have been multiple studies looking at chondroitin's effect on degeneration of the fingers and hands. And these are almost always long-term studies, so you can really get a sense of what chondroitin can do for you over time. The first study that I want to talk about was this one done in 2002, where they took a bunch of people that had advanced osteoarthritis of the fingers and hands. And they split these people up into 2 groups. Both groups were x-rayed to figure out how extensive the damage was in terms of joint degeneration and how many joints were affected in their fingers and hands. And then both groups were given the non-steroidal anti-inflammatory drug naproxen for the entire 2 years, and one of the groups was given 800 milligrams a day of chondroitin sulfate. They then re-x-rayed them at a year and at 2 years, and they measured how much advancement they'd had in the degeneration in the joints that had already been affected and how many new joints started to be affected over the course of that 2-year period. What they found was, in the group taking chondroitin sulfate, the advancement in the joint degeneration was significantly lower over that 2-year period, and they had a smaller increase in the number of joints affected by the osteoarthritic changes. So the group that was taking chondroitin sulfate fared much better over that 2-year period than the group that was taking naproxen only. This despite the fact that there was 2 major flaws with this study. Flaw number 1 is that these people were only given 800 milligrams a day of chondroitin sulfate. And the therapeutic dose for this substance is actually 1200 milligrams a day. And if they'd been taking that amount, it's quite possible that the results would have been even more dramatic. The second major flaw is that all the people in this study were taking non-steroidal anti-inflammatory drugs, and there are major concerns that these drugs are extremely harmful and actually contribute to the degradation of joint tissue. And even with all of that in place, the group that was taking chondroitin still realized a significant benefit. The second nutrient that you need to know about if you're suffering with these kind of problems is called MERIVA. And there have been a bunch of studies looking specifically at what MERIVA can do for people suffering with osteoarthritis and joint degeneration. Like this one from 2010 that looked at 50 people suffering with osteoarthritis and analyzed them in 3 categories. Category number 1 was how much pain and disability they had. Category number 2 was how functional they were. This was determined using a treadmill test to see how far they could walk before they experienced pain at a set speed and incline. Category number 3 was their inflammatory status, and they measured this by checking the amount of C-reactive protein in the body. Here's what these researchers found after having people take MERIVA for just 3 months. There was a 58% reduction in their levels of pain and disability. Their treadmill scores improved by nearly 80%, and there was a 94% reduction in their inflammatory status in just 90 days. MERIVA and chondroitin are just 2 of the substances that can be found in Movement Essentials Ultimate Relief Bundle. Between these 2 supplements, you're talking 19 essential nutrients put in combination to decrease pain, get rid of swelling and inflammation, have you moving better, and protect your joints for a lifetime. Click the link in the upper left to get your Movement Essentials today. Part 3 of this strategy jumps into the realm of high tech with the addition of light therapy. And this is something I'm really excited about. I've been using light therapy in clinical practice since way back in 2010. And over the years, it has consistently produced remarkable results in terms of reducing pain, getting rid of swelling and inflammation, and improving functionality. And it does this with no side effects and very low treatment times. And to give you a taste of why I'm such a big fan of light therapy, take a look at this study from 2012 that looked at a small small group of people that were suffering with chronic pain in their elbows, wrists, and hands. These people were treated with light therapy for 3 minutes, 2 times a week for 4 weeks. And in that period of time, the average reduction in pain was 45%. That's right, their pain levels were nearly cut in half with just 3 minutes of light therapy a couple times a week. Now let me show you how I use light therapy for hand and finger pain. The most convenient way I found to do light therapy on your hands is to place your device in a chair behind you, and then to sit down, put your hands behind your back like this, and then you just position yourself so that your hands are 6 to 12 inches away from your light source. That's going to give you more than enough penetration to get through the entire thickness of your hand. So you place your hands behind you like that, turn your light therapy device on, and then you just stay there 5 to 10 minutes and you're all done. The added bonus of doing your therapy this way is that if you have any lower back issues, you could lift up the back of your shirt and treat your hands and your lower back at the exact same time. If you want to know more about the science of red light therapy, its many applications, which device I recommend, and why, check out the video I posted here where I discuss all of that. The topic for this video was a suggestion from viewers just like you. So if there's a specific pain, posture, or rehab related topic that you want to know about, leave it in the comment section down below and I'll make a video about it. I'm also going to put down there links for the Neuro Ball and for Movement Essentials, but before you head over to pick those up, make sure to give this video a thumbs up and subscribe to the channel so that you're updated every time a new video comes out. That's all for now. See you next week.